A man walks into a dental office with severe pain, but when the dentist asks him to open his mouth, he refuses, not out of fear, not out of embarrassment. He calmly explains, "There's a demon living inside. If I open my mouth, it'll get out." When I first read about this case, I had to put the article down because I realized there are situations where dentistry is only half the problem. Let's call the patient Michael. He's 42 years old. For the past 5 years, he's been living with paranoid schizophrenia. He takes medication, sees a psychiatrist regularly, but then a new problem crashes into his life: unbearable tooth pain, infection, inflammation, risk of abscess. This is serious. He comes to the clinic, sits in the chair, explains what hurts, but when the dentist asks him to open his mouth, Michael presses his lips together and shakes his head. "I can't. There's a spirit inside. I can feel it. If I open my mouth, it'll break free." This is called religious delusional ideation, one of the most challenging types of psychotic symptoms. The patient is absolutely convinced his belief is real. You cannot reason with him. No arguments work. To him, this isn't a metaphor, it's a fact. The dentist realizes he can't handle this alone. He contacts Michael's psychiatrist. They begin working together. Gradually, over several visits, through therapy, through gentle persuasion, they build trust. The psychiatrist adjusts the medications. The dentist learns to speak with Michael in a particular way. No pressure, no mockery. They work in small steps. First, just sitting in the chair. Then, opening his mouth for 1 second. Next, examination. And only after 3 weeks, treatment. They stopped the infection, saved the tooth. Michael returned to normal life. But here's what haunts me. Patients like this often endure pain for years because they fear their own beliefs more than physical suffering. They avoid dentists. They don't seek help. They live with infections, decaying teeth, and it only worsens their mental state. Now think about this. How many people like this are sitting at home right now, refusing to open their mouths, not out of fear of the doctor, but out of fear of what they're convinced is living inside them?